you understand, because I don't forget things. I don't forget.
I especially want to thank the folks at the CDC, and it's a great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain.
I'd like to follow up on the issue of masks. In early April, the CDC reversed its initial guidance from masks being optional to advising the public to wear cloth masks in public spaces at all times. In spite of this advisory, U.S. culture has continued to be a barrier to a universal acceptance of these recommendations. Mask wearing, unfortunately, has become very politicized, and those who oppose their use argue that mandating masks is interfering with individual freedoms. A recent study by a group of Cornell University scientists showed that when quarantines are lifted, if 80% of the population wears masks with social distancing, the virus could be eliminated. Unfortunately, to date, only 15 states require the wearing of masks in communal places, and our president continues to flaunt his opposition to this public health recommendation. Based on the science, why did you initially recommend the mask as optional? And what fears do you now have regarding the spread of the virus if states and individuals can't be incentivized to wear masks in public, including during these massive protests that we have recently witnessed throughout our country?
Thank you very much. I think fundamental to this was the recognition of the importance of asymptomatic infection or pre-symptomatic infection. When this outbreak originally happened, CDC had the original 12 cases in the first January, February. We did about 800 contacts through our contact follow-up. 2 of those individuals were confirmed to be positive, both symptomatic and both spouses. So we had the view from our Chinese colleagues and their experience and our early experience that this was a symptomatic disease like most respiratory viral diseases were. But what we rapidly started to learn is there's significant asymptomatic infection or what we will call pre-symptomatic infection, and we've learned that the amount of virus that's shed in individuals that are asymptomatic is just as high as that and symptomatic. And when that knowledge base came, we realized that we had an important public health tool that we needed to take advantage of, and that's if people were asymptomatic or pre-symptomatically infected, if they were wearing a face covering, that they would have less ability to transmit to others. And that's why we embrace this important public health tool. And I will say that we continue to see this as a critical public health tool. As I said in my opening statement, that we ask the American public to be vigilant about utilizing, particularly as a major mechanism that we have to protect the vulnerable.
Dr. Redfield, your comment?
I'm not going to comment directly about the president, but I am going to comment as the CDC director that face masks, these face masks, are the most important, powerful public health tool we have. And I will continue to appeal for all Americans, all individuals in our country, to embrace these face coverings. I've said it, if we did it for 6, 8, 10, 12 weeks, we'd bring this pandemic under control. These actually, we have clear scientific evidence they work, and they are our best defense. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will. So I do want to keep asking the American public to take the responsibility, particularly the 18 to 25-year-olds, where we're seeing the outbreak in America continue to go like this, because we haven't got the acceptance, the personal responsibility that we need for all Americans to embrace this face mask. This is one of the most powerful weapons we have in the fight against COVID-19. Wearing a face mask whenever you're in a public setting, combined with social distancing and frequent hand washing, are all simple actions that we can take to help slow the spread of COVID-19. Americans continue to come together to take precautions to protect others from COVID-19. We all have a role to play in slowing the spread of COVID-19 and protecting each other, even if you are young and healthy. I wear a face mask because I want to ensure that COVID stops with me. So again, wear a face mask. Stay at least 6 feet from other people. Avoid crowds, and wash your hands at least 20 seconds on a regular basis. Together, we can fight COVID-19. Together, we can say, COVID stops with me.